it's a consequential year and it's a year of execution. But beyond that, let me give you a bit of a sense of the idea of where we came from and where we're headed, why this is so important as a legacy for us collectively, Nigerian health system. But everywhere we go, here the Nigeria's health outcomes are not as they should be. There's a gap between where we are, where we should have been, and having a North Star to say that let's improve population health outcomes.
In 2023, the Nigeria as a country started a fundamental reform for the health systems, and the National Nigerian Health Sector Renewal Investment Initiative was launched that will be driven through the sector-wide approach. The sector-wide approach is a network governance structure that tries to bring all levels of government, individuals and entities to collaborate together towards getting the Nigerian health sector moving.
With USAID funding, LHSS supported both the technical input to this workshop and also provided financial and logistics support. And from what we've seen, over 5 days now, our participants are well grounded and they are very good representatives of their respective states. What we have done in 5 days now is to build more capacity, give them additional information. Like our donor, USAID, will always say, that if you attempt to reform without being informed, then you would deform the system.
During this training, they've been given more concrete information about what SWAP is all about. They've been given more concrete information about their roles and responsibilities as SWAP officers. They have also been equipped, like I said, with some knowledge and skills that they need.
The president, has given a mandate, a clear mandate for the people to have access to quality health care. And I'm excited about what the coordinating minister is doing to actualize this mandate. So it is left for all of us, to key into this vision, make it a reality so Nigeria can be more productive.
Honorable Minister, I think today I'd like to physically introduce you to General Ashiru and his state lieutenants. As these programs begin to build up, that interface between SWAP as an approach to bring coherence, coordination, and governance, and the linkages to ensure that this year we are able to create that thesis that this approach has led to some impact. And I believe that this is the army that is required at the state level, straddle between ensuring that the processes are in place for sustainability, generalizing accountability systems, and the leverage required to work with other implementing agencies to accelerate improvement in health outcomes.
I think it's timely, it's not one-off. We will walk this journey with you. The results begin to show. You'll find that all eyes will be looking at Nigeria and what you have been able to do, and people will come to learn. There are many countries, ministers who have asked me, we want to come. I say, okay, come, but let's start to do something. They want to come and learn from you.
This training that we had over the last 3, 4, 5 days, it's an important additive to our health reform agenda. We've taken them through the health reforms in Nigeria, the health system strengthening efforts, the SWAP reform. We've given them the basics of how to lead, how to nudge, how to problem solve, how to manage their stakeholders in the state so that they are able to bring everybody to the table to set a right direction.
We started by teaching them about the rudiments of health system and the systems thinking. So health sector reform, basically, of course, when we talk about the health system, about the changes you put into the different aspects of the health system.
Realigning the institution so that it focuses on why it is set up. If the Ministry of Health, of Tertiary and Primary are set up to address the health need of the population, I can't see why it will matter if the life is saved by primary healthcare ministry or secondary. They will all be happy. We have achieved our goal.
In this work of stakeholder engagement, conflict resolution and negotiation, you must learn emotional intelligence. Diplomacy and tact, they say it allows you to manage sensitive issues without offending.
We have to fix demand, we have to fix supply to ensure there's a financial protection across for us across these 172 AGs to start with.
What we are really trying to do is to bring all of these things together, the sector-wide, to make sure that for that woman, what is it that she needs to survive?
Somebody is delivering a woman today in all of the villages across country. What can we do today so that that person that's already doing it, do it better tomorrow? If we think about it that way, it will help us move faster.
The topics that we have been introduced and we have been taken on are topics that you see in higher levels of trainings. So basically, this was a crash program of things you see in global trainings on economic development, on project management, on master's program in public health.
It's very, very educative, and it's going to be very impactful, considering the fact that apart from what we are taught concerning administrative issues, the planning, the budgeting, we are also taught about the MAMI project that is coming, and this is as we are taught.
We had a lot of learning on how to harmonize our AOP and all the materials we need to ensure that maternal mortality is reduced in Anambra State.
The maternal and neonatal mortality reduction initiatives which plan to crash the maternal mortality figure in the country. And of course, we've been taking through the different strategies where the federal government wants to collaborate with the state to onboard all these initiatives.
Graciously, let me say about 80% of my expectation was met, because to some extent the knowledge I needed, especially the knowledge about SWAP and then part of the Hope PHCs, where I was able to acquire such knowledge from here. I've improved very well in my negotiation skills, which I came here with little. I think I will negotiate very well, especially when it has to do with my superior officers, getting what I want, and also apply the noggin skill as well.
The training has actually met my expectations. If you look at it, I was trained on so many things, basic things that are needed for running the office of the desk officer, and then what is actually expected of us.
So we expect to see a movement using the sector-wide approach to improve the health system and health system outcomes in each of our 36 states at the FCT. We expect this capacity to spread across the health system, because they interact more with other members of the health system, going to be a positive influence on the health system actors and help us to move our health system to the next level, to the level where we can have better health outcomes across the states in Nigeria.
With the knowledge acquired here, when they move to their various states, they will begin, to seamlessly and effortlessly discharge their duty, in terms of goal setting, identifying a gap, having an idea, that it can't be silo thinking, it has to be all-inclusive, it has to be integrated.